12-year-old award-winning Ugandan non-profit called Conservation Through Public Health. Her ongoing work addresses issues vital to the well-being of people who share the space with the critically endangered mountain gorilla in the Bivindi forest. Gladys is a vet by training. She graduated from the Royal Veterinary College in the University of London and went back home to Uganda to start the Uganda Wildlife Authority's first wildlife veterinary program in 1996. She went on to do a master's in specialized veterinary medicine at the North Carolina State University and the North Carolina Zoological Park, where she studied disease issues at the interface of wildlife, people, and livestock. Thereafter, she started Conservation Through Public Health and began her work in Bivindi. In recognition of her work, she has received the Whitley Gold Award and the Conservation in Action Award of the San Diego Zoo. Today, she serves on the board of the Uganda Wildlife Authority, the Uganda Wildlife Education Center, and the Wildlife Clubs of Uganda. She is also the chairperson of the Buganda Kingdom's first Heritage and Tourism Board. To tell us more about her work with the mountain gorillas and the people with whom they share their space, please join me in welcoming Dr. Gladys Kalema Zikuzoka.
Good evening, everyone. I'm very happy to be here in India. This is my first time in India. I've heard a lot about India, and we have lots of friends from India in Uganda. Really, when I received an invitation from Dr. Madhu many months ago, I remembered that the last time I had seen him was when we both got the Whitley Awards in 2009. And should I speak through here? And I hadn't realized that you had such a great setup over here, and I've been very impressed by what I've seen. I'm going to talk about the work that we're doing. It's a bit unique. It's not common to integrate conservation and human public health, but it's something that I started to do, and today I'm going to talk about my journey in this area. I started off as a student researcher, like most of you here. I was doing my vet degree at the Royal Veterinary College, University of London, and I'd always wanted to study the mountain gorillas. I had set up a wildlife club in the secondary school I was at. I always wanted to study the mountain gorillas, and I got an opportunity to finally do it in my last year of vet school, in the holidays. So I went to Bwindi, and I went to Bwindi National Park at a time when gorilla tourism had just begun, and it was a very exciting time to be there. And I stayed at the tourist side of the park, studying parasites in gorillas visited by tourists and those not visited by tourists. After I finished that, I felt that I wanted to be a vet who should just work only with wildlife. So how did I get into conservation? I've just mentioned how it all began. And in this presentation, I'm going to talk about why we started Conservation Through Public Health, which is the main focus of the presentation, and how we set up an integrated model in Bwindi, and how we're trying to scale up to other ecosystems. Setting up the vet unit in Uganda Wildlife Authority was my first job out of university, a very daunting job, but very, very exciting. And within a few months of having the job, I got a report from the rangers and the warden that the gorillas in Bwindi, in one of the tourist groups, were developing hair, were developing white scaly skin and losing hair. So I spoke to a veterinary doctor, Dr. Richard Koch over there, who was working in Kenya Wildlife Service, setting up the department there. And he told me that he had ever seen cheetahs in Masai Mara that were also losing skin, losing hair and developing white scaly skin, and it was due to tourists visiting them a lot, and he thought it was sarcoptic mange. So I went and spoke to a human doctor friend of mine, And I said to her, look, I'm not sick, but the reason I've come in to speak to you is because we have this disease in gorillas, and I'm about to go up to treat them, and I don't know, what do you think it could be? And so she told me scabies, and I was very surprised because when I went to vet school in England, people didn't get scabies, and animals, dogs would get scabies, but they wouldn't spread it to people. And I knew that. She told me the reason why it's scabies is that scabies is very common in people in Uganda because it's a disease of poor hygiene and sanitation. So that was a surprise to me, and we went up to the park. We darted the juvenile because the baby had almost lost all its hair, and the mother wouldn't allow us near her. And we found that he was scratching even during the anesthesia. And it did turn out to be scabies. And eventually we found out, how could they have got the scabies, where could they have got it from? And eventually we found out that they got it from the people living around the park, who are among the poorest in Africa with very little health services. So mountain gorillas are critically endangered, and as much as they're critically endangered, conservation efforts are working, and the population is actually increased recently from the last census, which is carried out once every 5 years to fit in with the interbirth interval. So we now have around 880 gorillas found in Bwindi and Virunga National Park, of which 400, about a half of them are in Bwindi. This is their habitat. Some of it is similar to what I was seeing on the slides earlier today, but except there is one thing that is very distinct about Bwindi, is when it was created as a national park in 1992, people were told not to go into the forest anymore, and they just had to, and there's a hard edge, there's no buffer zone. So the gorillas don't know about this. Sometimes they come out into people's gardens and people go into the park, but it's a very hard edge. This is representative of the very high human population growth around here. In some parts of Bwindi, it's over 300 people per square kilometer. At the same time, people live very far away from the nearest health centers. And when they get sick, they tend to go to the traditional healer. And if they're not getting better, then they go to the modern healer. And when they get there, they find a long line, and they may not get the treatment they need. So how do the gorillas get the scabies? I came out of tracking a group over here, went out, and just nearby, there are banana plants. The gorillas come out and destroy the banana plants. They don't actually eat the fruit. They prefer the stem because they're getting moisture from there. And of course, the farmer gets very, very upset. I've seen some of the human-wildlife conflict presentations this morning, and I found them very interesting. We faced the similar issues in Uganda. So this particular farmer, his banana plant had been destroyed. He had just been visited by the most popular tourist group in Bwindi at the time, and we went over to see him because we were now starting some health education workshops. And I said to him, he was very upset. So I said, I'm really sorry about what's happened, but do you think gorillas are important? And he said, yes, because the individual farmer like me, my children are employed by the park, money from tourism is coming to the community, which in Bwindi it really has changed and transformed that community, where it's an act of parliament that 20% of the park entry fee has to go to the community, and more recently, $5 from every gorilla permit. He said that the individual farmer like me whose crops are getting destroyed, I'm not getting compensated. Tourists paid $500 to visit gorillas. I didn't get any, and they're visiting them in my garden, and they destroyed my crops. So why can't I get anything back? So that was a very big challenge to me. And I went and spoke to my bosses in Uganda Wildlife Authority and said, we really need to help this farmer. And later on, him and a few of his group ended up we helped them to set up a human and gorilla conflict resolution team of local community members trained by Uganda Wildlife Authority to chase gorillas back to the park. So we call it Hugo. So for all these reasons, we set up conservation through public health. And also actually during my master's in North Carolina, I looked at tuberculosis at the human-wildlife livestock interface. And that was also an eye-opener to look at how the public health system works in Uganda. And I was able to find out that most people live very far away from the health center. Not only do they get scabies, but they get even a worse disease, which is a chronic disease called tuberculosis. And if they go for treatment once, they won't go back again because it's too long. then they develop multi-drug resistant TB, which would be impossible to treat in gorillas. Because you require daily treatment for 8 months, and they're very intelligent. Once you dab them once, next time it's very difficult to dab them again. So we set up CTPH together with my husband, who's actually ever been to India, working with United Nations International Technology Education Services many years ago, over 10 years ago, and a vet technician. CTPH promotes conservation by enabling people, wildlife, and livestock to coexist through improving their health and livelihoods in and around Africa's protected areas. Yes, I do believe that people and wildlife should coexist because there's no other way. We can't, it's very hard to separate people and wildlife. And our vision is for people, wildlife, and livestock to live in balance, health, and harmony with local communities acting as stewards of their environment. We have 3 integrated programs: wildlife conservation, primarily health, but we're also looking at other issues in conservation which affect public health and conservation in general, community health, and alternative livelihoods. Our alternative livelihoods program started with telecenters because my husband worked in Orissa and helped people there to set up telecenters for rural farmers. And then we started CTPH, being our own organization. We could be as creative as we wanted to be. And he felt that maybe we could put up telecenters in Burundi for the local community. And we found that it was a very good way of engaging the youth in conservation. They really thought it was cool, learning how to use computers. We teamed up with Makerere University, the biggest university in Uganda. And right now in Burundi, everyone knows how to use the internet. They communicate with tourists. Long after the tourists visit, they've got sponsorships, they've sold crafts through the internet. It's a whole industry out there. So in gorilla health monitoring, we teach the park staff to identify gorillas. Each of them looks different, believe it or not. And when we teach them to identify the gorillas, they are able to be able to treat them and know which one is sick. And we also treat them to collect dung. We teach them how to collect dung from the night nests. We collect their dung regularly, at least once a month, and also when it's abnormal. We feel strongly it should be the park staff to do it because it's sustainable. Having worked as the vet for UA, I was used to people bringing projects and they come and go because they're not set up, they're not the system, the government has not adopted it. So I really made sure that we can try our best to get the government to adopt it. I really like this photograph, and it makes people laugh when I'm in a public health audience because it's something I'm going to talk about later in my presentation. But one thing that I learned from gorillas is they're very good at family planning. They have a baby once every 4 years without any modern family planning. And I always say this to people in Uganda because, I mean, that population growth rate is so high. We have like the highest in the world of 3.2%. And people are having babies every year, so it's a big challenge to them. And we also carry out other disease investigations. This is actually anthrax under the microscope. We've had anthrax in the other national parks, like in Queen Elizabeth, but it's also been found in the Thai forest, in chimpanzees in the Thai forest in Ivory Coast. This is one of our founder members, Stephen, looking at under the microscope. We built a gorilla research clinic. And the US ambassador came to visit because we were getting funding from USAID through African Wildlife Foundation. And our staff gave him a presentation. This is a dam that was put in the forest. Burundi is not on the electricity grid. And we spoke to UNIDO, who came in to help us to put up solar, and they helped to set up a microhydro dam. But while we do this, the gorillas cross the dam. This is now inside the forest. People share these same water sources. Over here, and the livestock share the same water sources. And most of the people in Burundi actually collect water from such a source. This is our community health coordinator. He has a master's in public health, and his first degree was environmental health. And he was speaking to the people here, and they were saying, yes, we collect our water from here. So we're looking at diseases like Giardia, which is a waterborne pathogen. We've actually not found it in the gorillas, the mountain gorillas, but this was something done by a good friend of mine. But we found it in the livestock and in the people who are sick through a partnership with the local hospital. We also look at samples of people who are sick, and then generally with livestock and the gorillas. This is a vet student from University of California, Davis, who was working with the community animal health workers who we helped to initiate in Buindi. We also carry out rabies vaccinations and treatments, working with the community animal health workers. I think tomorrow is World Rabies Day, just to mention. It was mentioned in some of the presentations. And this is a doctor, retired doctor who's on our board, Dr. Lynn Marrow, vet doctor. So now going on to the human public health. In my last year at Uganda Wildlife Authority, everyone felt that me being the only vet in the organization should develop a health program for communities. So they were already thinking One Health. And so I set about developing these brochures in English and the local language. It was very exciting for me and a turning point in my life. And we basically developed them and took them out to the communities. And I said to them, this is the problem. Gorillas are very curious. They'll go into your gardens. People tend to defecate in the garden. They don't cover their rubbish heaps. They leave dirty clothing on scarecrows. They're very unhygienic. So I said, and when they get to their garden, the baby gorillas especially are very curious. They'll touch human clothing and human feces and get sick, and it can spread through the group. And I continued to talk about, the importance of gorillas and everything. And then when I finished my presentation, and we went out with the community health assistants and the community conservation department of Uganda Wildlife Authority. After I finished the presentation, I was just about to tell them, and this is the solution, because I already had it laid out. And they touched my hand and said, let's hear what they have to say. And they had much better recommendations than I had developed for them. So for me, it was a real eye-opener about participatory rural appraisal workshops. And a lot of the recommendations they brought up is what we used to start up the NGO. So we gave them, part of what we do is we give them the brochure, and a drama group comes up with its own play. So we also reach a lot of school children who are the leaders of tomorrow. And this is one of our village health and conservation team leaders. She's giving a presentation to her community. When we started the program, women would never talk in a meeting. It was only the men talking. And then now, 10 years later, women are leaders, conservation leaders in the community. They get up and speak, and they're really confident, and we're really pleased about that. It wasn't something that we were aiming to do, but it's a very good benefit of the program. So one of the first things we started with was tuberculosis, and we hope to strengthen community-based direct observation of treatment. When I did the TB research, we went to visit, started TB treatment. I went back a year later, he had stopped it, and then one of them had died. So it was quite a shock to me, and that's when I realized that we really needed this program. In this program, your next door neighbor watches you taking medicine every day for 8 months. If you don't want to take it, they report you to the health center, and they come and follow up on you. So in the end, people end up taking the medicine. And what's interesting is we work with traditional healers. I never even thought that we'd work with traditional healers. But when we started off CTPH, the NGO, we invited people from the university, Wildlife Authority, tourism, all the potential stakeholders, and the Ministry of Health and the health officials. And the university, Mbarara University of Science and Technology, works with traditional healers. And they suggested we are in a perfect position to work with them. So we've learned a lot by working with them. Of course, they'll talk about things like we want to have free access to all the medicinal plants in the forest and all those kind of things. But they also admitted that they cannot treat TB or HIV because they're also dying of TB and HIV. And so they're ready to refer patients and become their volunteer, which is great. But they could treat everything else. Every single thing, hernia, everything they could treat. So why go to medical school? Then we added family planning. You may ask, what does family planning have to do with infectious disease prevention and control, which is the reason we started CTPH. But as I mentioned earlier, Buindi has very large family sizes. And in your average family size, when we did a survey before we began the program, it's like 10 children per family. And this is the children who live, the live births. In Uganda, the average size is 7, but in Buindi, it's 10 around the forest. And, we developed some flip charts. One thing I found in the public health sector is they have a very good way of behavior change communication. Because I looked around and I couldn't really see anything we could use for conservation. But in the public health sector, they always have the good family and the bad family. So we decided to develop this with our volunteers, the good family and the bad family. And so now this happens to be the bad family, which has many children. If you notice, half are going to school and half are not. When we did the survey, people would say, I have 10 children, half of them have to go to school, the other half are to stay behind and chase animals from the garden, chase wildlife. So there's a big issue right there, and they're all sick, and she's even expecting another one, yet she already has 10 children. And then eventually her children become, drop out of school, they have teenage pregnancies, and the cycle continues. Domestic violence, a lot of bad things happen in this family. In the good family, they have 4 children, 2 boys, 2 girls. When the gorillas come out into the garden, they call out the human-gorilla conflict team to chase them back, whereas the bad family will try and tackle it themselves. And eventually, the boy becomes a ranger, the girl becomes a nurse, and they have a big graduation party. So you say, which one would you rather be? But this is the reality. This is how people live at the edge of the park. So we also try our best to fit into existing structures for sustainability. And when we started out, there were no village health teams in the 2 parishes where there's a lot of conflict between people and gorillas. But later on, when we spread out to other parts of Bwindi and in Virunga National Park, they now had village health teams. So what we do is we call them village health and conservation teams. The government recognizes them. They visit at least 50 to 100 households every year. They're always visiting regularly, and they get people to change their behavior. They also collect monthly data for the Ministry of Health, Health Management Information System, and Uganda Wildlife Authority, on especially where there's human and gorilla interaction, or anything else Wildlife Authority would like to see. They're educating people on hygiene and sanitation, because that's really the main reason they have all these diseases. Family planning. This is a typical family. There are even a few more kids this side who didn't fit in the photo. And that's how it is, Each one is almost the same size, all of them. And so how many of these are actually going to make it to school and earn a living at the end of the day? So we do a lot of that. Education. We refer people for TB, scabies, HIV, diarrhea. Nutrition, we promote nutrition and sustainable agriculture. And that part, actually, the volunteers did themselves. They realized agriculture is very important to them. They have small plots of land. They're in a very hilly area. So they themselves go out and educate their communities about sustainable agriculture, gorilla conservation, forest conservation, and they're really doing a lot of great work. Here, this photograph was taken at the Ministry of Health, at one of the local health centers for the government. And we've been working with somebody from US who's a public health advisor, Dr. Lynn Gaffikin, who helps us to educate all of these communities. Now, what's interesting over here is she's giving an injection for contraception. In Uganda is one of the first countries in the world that did a pilot study to see if local communities, lay workers like community health workers, can give injections safely. Because when we started the family planning program, we found that most people were on the pill. They wanted to be on the injection. They first of all used to lie to their husbands. I'm going to the market. They go to the health center. They try and get a shot because their husbands would not be happy with them going on family planning. But we said to them, we have to do couple peer education. We don't want to have domestic violence because their husbands would beat them up. Why aren't you having children? Why aren't you having children? So from the beginning, it's been couple peer education. But a group called Family Health International, we started working with them because they were trying to get the Uganda government to make it a policy for such people to give injections. Of course, the medical doctors were very cynical, but we were one of the pilot sites, one of the 4 in the country, and it was shown that they could give it safely. This is Rehema giving a shot in her home, so that when this lady goes to the health center, she doesn't have to sit and wait. And when she sits and waits, she finds very sick children. The nurse doesn't even get to her. Then she conceives, and the problem continues. So this eventually became a national policy, and I was really pleased about that. And that's another thing I learned about the public health sector. They're very good at advocacy and research to policy. And so now it's become a national policy. And we'd like to push more conservation policies like that. This is a water source that was set up, and now one of our staff was talking to the communities about this. And one thing we found when we did a survey of about 2,600 households, that the people who had collected water from a non-protected water source were more likely to have dirty water collection containers and dirty water storage containers. So when we did the survey, we found that the indicators were very bad, but it was worse for people who see gorillas, because even the people who are right at the border of the park are poorer than the ones who are not. So although latrine coverage was actually very good, everything else wasn't very good, like hand washing facilities were less than 10, anal cleansing material, protected water source. Most of the people who see gorillas didn't have access to protected water source. However, they had very high immunization rates, which showed us that they respond to education. And after a few months, this was supported by the Whitley Fund for Nature, actually this particular study. After 9 months, we saw behavior change immediately. The hand washing facilities went up to from 11% to 30%. The anal cleansing material went up to 50%. From 27%, it doubled. And the clean water storage containers went up, and the drying racks. So that's when I started to see the power of behavior change communication, which I think is greatly needed in conservation. So some of the research questions we're asking is how effective is health as an integrated conservation and development intervention? That's the context in which we started this program, was as an ICD. And how is it contributing to conservation and development outcomes? Not only by directly preventing disease transmission, but also in changing people's attitudes towards conservation. And this is something that we're studying and teaming up with research institutions to see how effective it is. What diseases are shared at the human-wildlife-livestock interface, and how can they be prevented and controlled? How effective is livestock and other enterprises in reducing hunting and bushmeat consumption? Something that happened a few years ago, in 2010, a gorilla was killed by a poacher. Now, in Uganda, we don't have the same problem we have in Rwanda and Congo, where gorillas have been killed or the baby gorillas are taken away. We haven't had that problem because from the moment it was created as a national park, the local community was engaged from the beginning. So former poachers were made into trackers. We call them born-again poachers. They earn more protecting animals than killing them. And so everybody, in fact, one time someone wanted to poach gorillas. I think he had got money from, someone was going to give him money from another country, and they tipped off the rangers and they caught these poachers. But in 2010, a gorilla was killed by a poacher, and my team went out and did the postmortem and found very many spear wounds on the gorilla. But the park was able to get the police to follow the blood of the hunting dog, which he used, and they followed it to somebody's home, and they were able to catch the person. And unfortunately, he was let go because he bribed the magistrate, and he only had to pay equivalent of $20, which is a big shame because tourists pay $500 to see gorillas, and they bring in over $1 million. Each group brings in over $1 million a year to Uganda Wildlife Authority. But one interesting thing is that this particular hunter, because he's a well-known hunter apparently in the community, had ever received a goat from Uganda Wildlife Authority a few years before this incident happened. And this was like, we're giving you a goat so that you stop hunting, you don't kill the animals. But he had forgotten all about the goat because the gorilla got into a fight with his very pressured, very valued hunting dog. And so it makes you think, how are we doing ICDs? And that's kind of one of the things that it's really made us think about. How are we doing the integrated conservation and development initiatives? And how effective is ecotourism implemented to minimize risk to great apes and the environment? Yesterday I was in a session on media and conservation, and I brought up a case of a gorilla that was groomed, a gorilla which groomed a tourist, and it went on the internet, 11 million people saw it. And because they're so used to people now, but you can imagine what happened over there, what diseases could have been spread. This tourist had like bird flu or something, a whole gorilla group or a whole numbers of groups could be wiped out. And of course, tourism has to benefit the community, and that's part of ecotourism. So this is an example of a student who came to interview tourists to see if they're willing to wear masks when they're visiting gorillas. She came from Kent, University of Canterbury in Kent. And so she asked them about their experience, what they like, what they dislike. And actually they even said, where does all our money go? There are many poor people around us. And little do they know that the communities have really developed. They were even worse off. But it was a very valid question to ask. And it turned out that the tourists were willing to wear masks as long as you explained to them what it was. So here's a very nice lodge where the tourists stay. Bwindi is the most expensive place in Uganda to stay because of the tourist lodges. We also have students, medical students as well, coming in, and also students studying the role of women in conservation. We host all kinds of students studying different kinds of things. We scaled up the project to Virunga, which is even worse off than Uganda. People are even poorer. If you notice, they have like, they don't even have iron sheet roofs on their houses. And they really embrace the program because even if it's a largely Catholic society, they feel they have too many children, it's making them poor. And they really wanted contraception. The only problem is in Virunga, in DRC, you have to buy them. In Uganda, they're free. But we're trying to work on that. And this is an unprotected water source in Mount Shabirumu that they tend to use. So how do we sustain the village health and conservation teams? I talked about teaming up with people who know how to do development. Conservationists, we don't really know how to do development. And so one of our staff, Stephen, who used to work for Ministry of Agriculture for many years as a vet technician, when the volunteers asked us for goats and cows to sustain themselves, he said to me, we have to make it a group activity. Don't give them an individual goat or an individual cow. Because there's an NGO that had given the Hugo members, the Human Gorilla Conflict Team, individual pigs, individual goats, and they forgot about them and started saying we still want a salary because they're supposed to be volunteers. So in this case, we gave them group activity. So each parish had its own group. One had goats, one had cows, and it worked really well. It brought them together. The money that they made from it, they developed a very good enterprise, and later they met up with CARE and Bindi and Mugahinga Conservation Trust and reinvested it into village saving and loan associations. We also gave them bicycles and cupboards, and now that's when I realized, how am I doing? I'm a vet, how am I now doing microfinance? And actually microfinance, it's not us who introduced it to the volunteers, but they met other NGOs that were promoting it. And so they've doubled their income, they're saving money, and they're very happy. They've continued without donor funding. This program is continuing without donor funding, and they're continuing to check on people, change their behavior, and we want to scale it up all over the forest. So this actually won us an award from the Global Development Network, Japanese Most Innovative Development Award, Project Award, within the category of Sustainable Development. So we so far trained over 120 volunteers in Burundi and DRC. The Burundi volunteers are consistently reaching 11,000 people with conservation information. I think it's a very effective way of carrying out conservation education. And the Kisoro volunteers are now reaching an additional 11,000, and in Virunga it's about 22,000, although it's not consistent because there's so much insecurity. And we want to see how to address that. But we've had increased reporting of human and gorilla interactions, increased monitoring of diseases such as intestinal parasites, Giardia, Cryptosporidia, Salmonella. And then some of the impact we've had a 12-fold increase in new family planning users. Over 60% of women are now on family planning. We started off when it was about 20%, and the national average in the whole of Uganda is 28%. So this is a very effective way of getting people to change. There's a 50% increase in hand-washing facilities, 11-fold increase in TB suspects referred, and men are more involved in family planning. And then on the conservation side, we've had reduced human and gorilla conflict, we've had reduced disease incidences in the gorillas, and we've had improved conservation attitudes. Like when this poacher when the hunter killed the gorilla, the volunteers were the first to tell me, can you believe it? He only got away with paying $20. So they were very, very upset. They were even more upset than Uganda Wildlife Authority. And they said, that's not right, our gorilla shouldn't be killed. And then then later on, the old silverback of Ruhendeza group, which was one of the first groups to be habituated, when they get very old, they can't keep up with the group, and they're left on their own. Because he had seen tourism developing for 20 years, this gorilla, he decided that he wanted to spend his last days in community land, not inside the park where he's going to have to fight with other silverbacks for territory. So he settled outside the park in community land. And the Wildlife Authority called me and said, come and translocate this gorilla, And we're like, we went over, we studied the situation, and we said, even if you translocate Ruhendeza into the park, he's going to come out again. There's a reason why he's here. He feels safe. And he could eat occasional banana plant and from time to time. But we talked to the volunteers, and we said, look, this gorilla has brought you a lot of good fortune over the 20 years because he's allowed tourists to come and visit his group. And now there's a very good tourism industry. So can you protect him? And they said, yes. When our people grow old, we also protect them and look after them. So Ruhendeza was looked after right until when he died. And women and youth are now more involved in conservation. So we feel that we have a sustainable and scalable model which we want to take to other places. We also started doing work in a savanna ecosystem. So we're doing the same thing, but we're not yet introduced family planning, which is still a bit of a controversial topic, but we also haven't got the funding to do it yet. And of course, here the issues are very different. The community hates the park with a passion. In 1950, when it was created, it was one of the first national parks. It was fences and fines, communities out, people in. When the British set up this park, they didn't know, but they thought that the people in northern Uganda are better at fighting. So they brought them to southern Uganda to be the rangers. And so the people from the area were not even employed by the park. So they have no connection to the park. And it used to be their grazing grounds inside the park. It's a very important cultural site. And so there's always fighting back and forth. And so when we started this program, we thought, let's focus on what they value most, which is their cattle, their pastoralists. And we're improving the livestock health and husbandry, and have a group called Conservation Community Animal Health Workers. We also do disease investigations in buffalo and cattle. And the Duke of Edinburgh, don't know if anyone can recognize him, he's over there. When we had the Commonwealth Heads of Government meeting, the British High Commission gave us funding to set up a telecentre, like in Burundi, that had been set up. And because they saw that it was working, and we employ women from the community was very happy about it. And Lawrence gave him a presentation about everything. I mean, he was extremely knowledgeable about very many things. He had been to the national park 52 years before that with his wife, just before she was named the Queen of England. So he was quite excited to come back, and he was happy that we were working with communities and develop, because he recognized that in his time, when they came 50 years ago, it was very different. And in Queen Elizabeth, we've had anthrax. It killed very many hippos. The first time it killed over 300, and it killed almost 10 people died and 200 people got sick because they ate hippo meat. In 2010, when CTPH joined the Uganda National Task Force, we concentrated a lot on community education, and we again used the same group of animal health workers, community animal health workers. And also, I saw earlier today the use of mobile phones. We set up a disease communication platform. We sent SMS alerts in the local language about anthrax, what to do, how to avoid anthrax, don't eat an animal from an unknown cause, and all of that. And we had no people getting sick and no people dying, and 100 hippos died because the group that was burying them buried them quickly. So we're pleased about that. This same community that hates the park with a passion, because of our interventions and our approach to working with them, they actually love animals. Whenever we did any wildlife work, they wanted to be part of the intervention team. They rescued this baby elephant, which was drowning by their village. The mother, I think, had been killed by a poacher. And they brought it to the shoreline. So the warden said to me, you know what, Gladys, your volunteers, they came and rescued this elephant in a crude manner. They put it on a rope, on a canoe, and brought it to us. So he took it to the Uganda Wildlife Education Center, and now he's a major attraction over there. He wouldn't have survived otherwise. Hamukungu. It's my son Indigo and the vet for Uganda Wildlife Education Center. So just to finish off the presentation, we've just started a project in another part of Uganda, which is a very interesting area because it's actually a wildlife reserve, not a national park. And so they allow some controlled grazing. And in this park, it has very rare species like the roan antelope, kudu, and wild dog, but they're almost, at least the roan antelope's numbers are big, but they're very, very, very shy. So I took this photograph. You can't see any animals. They're running away from us. But it has very huge tourism potential, but it's under great threat of degazettement. Because the community doesn't see the use of it, the politicians don't see the use of this area, and they want to keep telling Uganda Wildlife Authority to reduce it, to cut it down, but it's the second largest protected area in Uganda after Murchison. And so we felt, I'm on the board of Uganda Wildlife Authority, and when we went to approve the first general management plan for Pianupe, I led that team. They said to us, we're not working with any NGO here. All the NGOs are working in the community, addressing livelihood and other issues. So we got funding from the French government and started a project here. And it's really interesting. We carried out a survey of about almost 2,000 households. And they told us that we were quite shocked to find that 83% of them wanted the park to be degazetted. And those who didn't want it to be degazetted was for cultural reasons. In the Karamajonga, just like where I come from, in central Uganda, you're not allowed to harm or kill your totem. My totem is the lion, so I'm not allowed to kill a lion. And I always joke that the lion also won't eat me, but it probably will. But then, it's a way that we were able to conserve the different, your totem can be an animal or a plant. We also found that only 10% had ever received conservation education, and it wasn't from Uganda Wildlife Authority, but from an environmental NGO called CACHEP. As you can see, these are the Karamojong. They're very similar to the Maasai. They live in manyatas. And so how are we addressing this issue? We are carrying out disease surveillance of wildlife and livestock to prevent disease transmission. And we've created another group of conservation community animal health workers. Karamoja has very many community animal health workers because they're largely pastoralists, and 95% of the community members trust them. They really believe in them. So we're teaching them to be conservationists as they're treating people's cows and goats and promoting human health care. They're also promoting conservation. They themselves suggested that we should set up village conservation committees. They will set them up and they will manage them and get these people to start to like the nature again by using culture as a vehicle. So we're doing advocacy for population health environment because that's what we do with support from PRB. And because of that, we were an advocacy partner on a project in Lake Victoria Basin, and they're using the same village health and conservation teams in the Lake Victoria Basin where they have deforestation, overfishing at high levels. So we want to scale up the approach to other protected areas. We want to advocate for these approaches. We're a member of the Uganda Poverty and Conservation Learning Group, which is created by IIED, International Institute of Environment and Development. We're also started the Uganda Population Health and Environment Working Group. Our patron is the Queen of Buganda, and we feel that when we have such a cultural leader, who was the first queen in the world to track mountain gorillas, when she came to launch our projects, she can get Ugandans to support conservation. And on my position as an UA board, I'm really getting them to get more interested in promoting community conservation and strengthening that department. And luckily, I'm supported by a lot of the other board members who also have worked in the parks. And we want to work with research and higher learning institutions to study the impact of our work and improve it and build evidence for scaling up. And we want to host students for field practical experiences, which we've started doing, primarily international, but also some Ugandan students. And we're building a permanent health and gorilla conservation center. Right now what we have is temporary structures, but now we're building one. With support from Task Trust, we've started to build. And it's going to be doing disease diagnostics and community education. The very nice view of the park, which looks on top of Bwindi National Park. We want to acknowledge very, very many people. I couldn't fit them all on one slide. And I want to thank you all for listening to the presentation. For more information, visit our website. And we're now pretty active on Twitter. Thanks, I've already seen some tweets that went up just before I presented from SSC Bangalore. And join our Facebook page. Thank you very much.
Hi, thanks for the talk. I don't know, usually I'm the guy who brings up the population question at this conference every year.
Yes.
So I was actually glad to see one presentation talking about it and someone actually doing something about population control. So I just wanted to say thanks for that.
Okay. Thank you.
That was it, no question.
And I think you can also do it here in India. Definitely, you can. The conservation NGOs can actually start doing family planning.
Hi, Gladys. Hello. Thank you for your inspiring talk. I have a question about your public health work.
Yes.
What is your secret to gaining the trust of the communities? Because from the news reports of how they are fighting the Ebola virus, we see that certain communities, they display surprising levels of hostility towards health workers, but this obviously did not happen in your case. So what is your secret? Thank you.
Okay. That's a very good question. Actually, Uganda, I think, has done very well. We've had Ebola outbreaks in Uganda too. And the Ministry of Health, I think the village health teams, the volunteers, because when you have your next door neighbor telling you don't do something, you're more likely to listen to them than a health worker who is paid by the government. And the government the communities feel the government doesn't do very much for them. So when the health worker comes and tells them do something, they're like, but it's from the government. So actually one of the people who has the TB and leprosy program, when we started our work, he said to me, the communities are more willing to listen to themselves. He actually said to me, NGOs, you play a very important role for us. He says, when we go to the communities and tell them to change their behavior, they won't listen to us. But if an NGO goes and talks to them, they're more likely to listen. So he was really happy that we're going out there and spreading, help trying to prevent TB around the national park. And I think with the Ebola situation, they need to work very closely with community volunteers to change people's behavior. One thing also in West Africa is that people believe a lot in witchcraft. They also do in East Africa, but it's more in West Africa. And the first reaction, like in Central Africa when they had Ebola outbreaks, which killed actually very many gorillas and people who ate the gorillas, at least over 1,000 gorillas were killed in Congo, Brazzaville, Gabon, that area. They found that they really believed a lot in witchcraft. And trying to get people not to eat, to think that when you're dying and you have blood coming out everywhere, it's not someone who's bewitched you, but it's really a disease. And don't touch your sick patient or don't touch your dead relative. It's very, very difficult. But I think if you get the buy-in of the traditional healers, who everybody really believes in, I'm sure they do in West Africa, you get their buy-in, because actually the traditional healers are extremely intelligent people. That's why they're able to be traditional healers in their community, and let them understand what is happening, because they understand disease to a certain extent. And then I think in that way you can really get the buy-in. So I think working with the correct set of local leaders in the community will really help you to get the buy-in and trust of the community. And actually when we selected the volunteers, it wasn't us who just selected them. We had a meeting with the local leaders. We told them what the volunteer needs to be able to do. They need to be able to read and write in the local language. They have to be literate. They have to be respected members of the community so people can listen to them. And so they're the ones who selected volunteers. And one good thing is that half of them happen to be women and half happen to be men, which I think is very important because we're addressing issues that affect both men and women. Although the women don't like a man injecting them. So when it's come to that part of family planning, the one volunteer who happens to be a Hugo member, and he's learned how to give injections, he says that he gets very few patients because the women feel uncomfortable a man injecting them. That's still a cultural issue.
Hi, Gladys. Yeah, sorry. I actually wanted to ask you how the people of Uganda, or the people that you worked in the area, how what kind of relationship they have with the government. I think you already explained that.
Yes.
But I was also interested in knowing how has your relationship as an NGO, as a founder of an NGO, and as being a member of an NGO with the government changed? What was it like, and how has it changed all these years?
Yeah, that's a very good question. I think what we did is, having worked for the government for 4.5 years, I could see how the government feels about NGOs. Basically, they always used to say, I don't know what this NGO is doing, Because what happens is that NGOs come in and tell the government, this is what you're supposed to do, quite arrogantly. They don't ask the government, what do you think of what we want to do, and get their buy-in. So I saw that because I used to like the work of the NGOs. I understood it, but most of my colleagues didn't. And so what I did is, when we started the NGO, we said, let's first have a meeting with the government. We had a strategic planning and stakeholders workshop. We got $6,000 donation, our first donation from the North Carolina Zoo. And what we said is that we're not just going to use it to survive as we set up the NGO. Let's hold a workshop and invite all the key stakeholders and get the governments to tell us what they think we should be doing, and everyone else. And that really worked. So from the beginning, we got their ownership and buy-in, And they actually even improved on what we wanted to do. And okay, sometimes they would say, oh, what's the NGO doing? Or they still have that. They still don't trust NGOs that much. And also you find that NGOs also don't trust government that much. But, but as we've gone along, I think we try our best to share everything that we do with them. We try our best to train their staff. When we go out to treat animals, we go out to carry out disease surveys in the wildlife. We make sure with the ranger, the veterinarian of the national park, when we go to the communities, whenever we have a meeting with the communities and the volunteers, we insist that UA has to send us a warden or a ranger, a senior ranger, and the district health people have to send us somebody. So whether they like it or not, they have to understand what we're doing and they are buying into it. But I think the relationship improved to this level that when they were looking for board members for Uganda Wildlife Authority, I was appointed. And when the minister made the remarks in the press statement, he said she set up an NGO which is promoting coexistence between people and wildlife, and it's that experience that we want on the board. And so I happen to be the first board member who's ever sat on an NGO. All the other board members have been either in the scientific sector, have been either researchers, because they have one space for someone who's a scientist. And they ended up selecting me. They normally select people from the university. And I think the reason why is because they were like, look, maybe we can learn something from this NGO partner of ours. So I was really pleased about it. Of course, the NGOs were excited. And they came to me with all their issues with UA. We all have issues with UA. But, but I also found that the NGOs needed to work better with the government, and the government needed to work better with the NGOs. So I'm trying my best to bridge the gap between the two, because I really think we can complement each other. I sometimes feel like a schizophrenic, because sometimes I'm wearing the government hat, and sometimes I'm wearing the NGO hat. It's a bit weird, but I can see the role that each of them can play in promoting conservation. And especially if they work together, we can do a lot together.
In the last few years, most of the major pandemics have started off in populations of pteropid fruit bats. You're working in Uganda, and of course many parts of West Africa are currently experiencing Ebola, which, like many of the pandemics, comes from fruit bats.
Mm-hmm.
Have you worked with anyone either on bushmeat and especially on fruit bats, on communicating the fact that actually eating some of these things really is a high risk to human health and needs to start stopping?
Yeah, that's a great question. We are on the Uganda National Disease Task Force, and basically it brings together, it's a multidisciplinary team. It's either headed by the Ministry of Health, if it's a human health related disease like Ebola and Marburg, or it's headed by the Ministry of Agriculture, if it's an animal disease like anthrax. But our NGO is part of the task force, and CDC has gone out, is also part of the task force. They've gone out, whenever we have these epidemics, what you find is that everybody rushes to treat the sick people. So there's many groups, but the case management group gets the most support, emergency support. The social mobilization gets a bit of support. The ecological one, which I think is the most important, hardly gets any support because everyone goes in panic mode. So when you have these meetings, the other teams have many more resources. They go out. The ecological one doesn't. But CDC has come in, and every time they've sampled fruit bats in Uganda during an Ebola outbreak, they found them all to be negative. But they did sample fruit bats for Marburg, when we had a Marburg outbreak, in the caves in Queen Elizabeth National Park. One tourist got droppings of Marburg on her body and died, like about 3 or 4 years ago. And they did find exposure to Marburg. They found quite a few bats which had Marburg. And also in a railway somewhere and in some mines. So there is some work being done on bats. The good thing in Uganda, what helps us is that people don't eat a lot of bushmeat in Uganda. They don't eat a lot of bats. They will eat other kind of animals like daika, but they won't eat bats, and they don't eat a lot of primates. The people who eat primates are more at the border with DRC. So that helps us a bit. But I know in West Africa, they really eat bats. It's one of their delicacies. And yeah, it's something that everybody, blames the bat for everything, I guess. But yeah, it's an area that we want to study more. We just lack resources. And it's a pity that whenever you have these outbreaks, nobody looks at where it's come from. I'm sure it's the same thing happening in West Africa. Some of my colleagues in the medical sector, public health sector, have been sending us emails from West Africa. They've gone over to help out. Quite a lot of Ugandans have gone over to help out. And they're just telling you it's chaotic, totally chaotic. And of course, everybody's rushing, they're panic mode, but at least they're trying to get people to settle down and think more strategically how to address the issue.
Okay, thank you very much. Your program is sound very successful. And how can you work with the community to involve in your projects? And the next question, you said that you are not really trust for the government. And what happened when the NGO gone? Do you think that the community can survive by themselves? And the last question is that primate has become one of the more popular in ecotourism side. How can you prevent disease from human to primate? Thank you.
Yeah, and actually thanks for that question. When we started off CTPH, from the beginning, we wanted everything to be sustainable. So the main people who we work with to change and to strengthen and build their capacity is the government and the community. Because we know that NGO funding from donors comes and goes. It's happened with us. And that's why we really like the village health and conservation teams, because they have continued without government funding. And what we do is we make sure that they work very closely with the Ministry of Health, so they collect very important data for them, and they work very closely with the Ministry of Wildlife, Uganda Wildlife Authority. Because we want that even if we move, we're not able to continue working there, and actually we do want them to continue on their own, and they have. We really want the government to use them as a vehicle to reach the communities, because they're able to reach very many people in a very short time and change their behavior. And so we really think it's important. Because actually when we started the NGO, Bindi had already had ICDs, Integrated Conservation and Development Initiatives, for 10 years before we started the NGO. And when they did a study, they found that the poorest people, as much as Bindi was created in the right way, by engaging the communities, unlike Queen Elizabeth, the older parks, they found that the poorest people were still not benefiting from the ICDs. So when we would have a community meeting, it's the elite in the community who would go to the meetings and decide things which suit them. And so these are the poorest people who are going into the park to poach animals. Whenever a child gets sick, all the drama shows show, whenever my child gets sick, the only thing that can treat them is game meat. They go in and get a daika. They go in and collect firewood all the time, and all medicinal plants and all kinds of forest products, which UA allows in certain parts of the forest. But they're the ones who have to go into the forest to survive. And so they found that those illegal activities were still continuing in spite of money coming from tourism and everything. And so the Poverty and Conservation Learning Group is really studying this issue. And when we started CTPH, I said to the volunteers, look, I know it's very difficult going to the homes which are bordering the park. It's very steep. It's difficult to get to. It takes you an hour to hike up to someone's house. It's like hiking, going looking for gorillas. And I said, but those are the people we need to reach. So immediately they started reaching those very people who no one reaches. They don't go to community meetings. Their children don't even go to the schools that have been built by the park because they're too busy chasing wildlife. They're actually reaching the people who need to be reached. So I think that this kind of approach where you engage the government a lot and in that way can continue even when funding from the NGO runs out or you decide to go to another area. Yes.
Hello, thank you very much for your presentation. I was just wondering, you said that you use hormonal implants, depots, as a method of contraception in ladies.
Yes.
So are they informed prior to the implant by regarding the potential disadvantages that those hormone implants can have on them because of prolonged use?
Yes, they are. And actually, when we started off the family planning program, there were very many myths and misconceptions about family planning. And they had so many funny stories, honestly. If you take family planning, your uterus is going to disappear, and they had all kinds of crazy myths. And actually, the Mbarara University students, Community Public Health Department, the community health students from the university, doctors and nurses, spoke to them and held many focus group discussions with them prior to starting the program. And so we realized that what was really stopping people, one of the barriers was all the rumors about the side effects. So when we started the program, we had a nurse midwife who was employed, USAID actually approached us to give us funding for this because they liked the way we were working with the communities with the TB work. But they insisted that we had to hire a nurse midwife, which we did, who had an experienced nurse midwife who had experience in family planning, providing family planning services. And so what happens is the volunteers are taught how to counsel for side effects. And they're not allowed to put someone onto a method. They refer them to the health center. And once the health center puts them onto a method, then they counsel them. There's a certain lady, for example, who had 9 children, and she went on the implant. And so I said to her, well, that's great. I said, why don't you just have a tubal ligation? She goes, no, my husband won't allow me to have a tubal ligation, but he's happy for me to have an implant. They already have 9 children. So, and I said, okay, can you go on radio with your husband? She said, yes. And she went on radio with her husband and the volunteer who had trained them. But she actually complained that she was having side effects. And the nurse was telling her she was bleeding, and the nurse said, it's going to go away, and she gave her all the right counseling and everything. And she went on radio, and because of that program, so many people started joining the family planning, wanted to go into family planning. So it's very much, we really sensitize them about the side effects, because that's the main reason why they don't go into family planning. So it's the first thing that we try our best to do. But however, we're trying also to go into longer term methods. We're teaming up with public health groups, to promote like the IUD, because after you've had, honestly, once you've had 9 or 10 children, I think there's no need to be on the pill every 3 months or, implant. You might as well just get a very long permanent method or a long-term method. So yeah, we're trying hard to work on that. And it's going to take a while to see the effects on the pressure on the natural resources, but I think it's the single most long-term method to make sure that the protected areas are going to be there for future generations, because all over Uganda there's so much pressure to degazette, and I know in other countries as well, Kenya, DRC, where I've started doing a bit of work with other groups. But because everyone says the population is growing and the protected areas are not getting any bigger, and every time it's election time, they pressurize the politicians to degazette because they want votes. And it's continuous every 5 years when we have elections. And so the Wildlife Authority is a very big advocate. They really want family planning around most of the protected areas, especially where there's very high human population growth.
Thank you, Dr. Gladys, for this presentation. I have a few connected questions. Like there is a general perception that ethnic conflict is one of the prime concern in Africa.
Yes.
I want to know that, do you face this kind of, is it true in case of Uganda as well? And if it is yes, then do you find these kind of problems while in your efforts?
That's a great question. Actually, we are very lucky in Uganda that we don't really have much ethnic conflict. It's a big problem in Rwanda. I think you heard of the genocide, the well-publicized genocide between the Hutu and the Tutsi. In Uganda, it's not such a big problem. We do have a bit of tribalism, but it's reduced by the fact that the president of Uganda makes sure that everybody from every part of the country has a senior position in government. And also, in the national parks, we can't afford to have it because the parks are everywhere. So almost every tribe is represented. But some of it is cultural. Like in Pianupe, we've just started to work in Karamoja. They have a lot of cattle rustling. They raid cattle from each other. They've been doing it for thousands of years. So you get the Pokot from Kenya coming in and raiding the Karamojong in Uganda and vice versa. So those kind of conflicts are still there. And in Burundi itself, we have the Pygmies, the Batwa. We call them the Batwa. But they are forest-dwelling hunter-gatherers. And when it was created as a national park, they were told that they had to get out. And a number of NGOs are working with them to help them to live outside the park. It's a challenge because they're so used to being in the park that everybody's working with them in different ways to make sure they benefit from the tourism industry. And we have just got some funding from US Fish and Wildlife Service to also work with them and improve their health. There is they do have an inferiority complex because they're not educated, like the majority Bachiga. But we do find they're also very, very intelligent. And if, for example, when we have in our laboratory in Burundi, the temporary field lab that we started off with, we often get bees because they're attracted to the reagents that we're using. And the only people who can get rid of those bees is the Batwa. They will come and do it without anything, and They won't ask for anything much in return. So they have some indigenous knowledge that can get lost if we don't nurture that. There's many, many things that they do which will get lost if we don't nurture it. So there's a big move to engage them in the community. The Bachiga try their best to assimilate them and engage them. They still have a bit of an inferiority complex, but everybody's trying to make sure that we address this issue. So we're lucky we don't have much ethnic conflict in Uganda, but it's a problem in Rwanda and in DRC.
Thank you, Dr. Gladys.
Thank you very much, too.